Hi, my name is Lorena. I'm a student at St. John's University, and I'm part of Collaborative Health Integration Research Program. And today I'll be talking to you about healthcare service utilization. So, healthcare service utilization describes the type and frequency with which individuals seek and use healthcare services to prevent or cure health problems, maintain health status, or to gain information about their health status and prognosis. High rates of healthcare service use have shown to be affected by a complex interplay of risk factors like sociodemographic characteristics, homelessness and clinical needs, psychiatric diagnosis. Studies have suggested that a better understanding of diagnostic subgroups may be needed to more effectively target interventions and allocate hospital resources. Alcohol use disorders, in particular, including alcohol intoxication and dependence, are increasingly common among patients presenting to acute care settings. According to 2018 national survey, alcohol-related encounters in the emergency room increased 61% between 2008 and 2016. Although alcohol use disorders are frequently present among patients in acute care, this population is highly heterogeneous in terms of risk factors and treatment needs. However, this has not yet been directly studied. We aim to examine the heterogeneity within a population of patients with alcohol use disorders. We expect these groups to have unique sociodemographic and clinical characteristics, along with differences in patterns of service utilization. The study sample consisted of all patients with primary or secondary alcohol use disorder presenting to acute care at New York area hospital over 3 years. This comprised over 12,000 unique patients and over 24,000 encounters. A latent class analysis with 1 through 10 classes were estimated. The 5-class model demonstrated the best fit based on bias C, classification accuracy, and interpretability. Within the sample, we found subgroups that varied based on demographics, such as age and homelessness, health behaviors, and clinical characteristics. For example, compared with other subgroups, Class 3 included older patients with high disease burden, alcohol dependence, and associated medical comorbidities like liver disease, fluid and electrolyte disorders. Nearly 90% of encounters by Class 3 resulted in inpatient admission. The other class, Class 4, was composed primarily of older patients with comorbid alcohol use and chronic medical conditions like hypertension and diabetes. Classes identified with LCA also differed based on the type and amount of services they utilized. For example, the same Class 4 had the highest dose of readmission at 3 months and 1 year. In the identification of alcohol use disorder, subgroups may aid in tailoring intervention for the increasing proportion of acute care patients. By understanding how all of these risk factors differ within this population, it may allow for easier allocation of healthcare resources and better tailored treatments. Thank you.